I want to speak with you today about incidental COVID hospitalizations, what that term means, and why it matters, perhaps more now than it's ever done before. So, right now, you're hearing a lot of talk all across Canada about the prospects of a fourth wave. What's going to happen? Is there going to be these massive rise in case counts? Oh, well, cases don't matter anymore. Many chief medical officers tell us, stop looking at the case counts, look at the hospitalizations. Okay, fair enough. What's going to happen with the hospitalizations? A lot of people threatening the idea that, well, there's still unvaccinated people out there. They're going to be filling up the hospitals and so forth. And some people even floating the prospects of another lockdown, even though the majority of people are vaccinated across the country, even though a number of provinces have brought in these vaccine passports, which were supposed to be the thing that would stop us from having another lockdown. But, oh well, apparently they always leave lockdowns on the table. Incidental COVID hospitalizations, what are they? Well, I want to tell you about a report that came out a few months ago about pediatric hospitalizations in Canada. So the official statistic was that there was something like 1,500 kids who had been hospitalized with COVID throughout the entirety of the pandemic, throughout the past year and a half, whatever the time frame that particular study was looking at. What they did do, though, is they looked at what were those kids actually admitted to the hospital for. And what was very interesting is they found that only just over a third of those kids had actually been admitted for COVID-19 because they were suffering for symptoms of it. They needed to be in a hospital bed to be treated for COVID-19. No, what was actually going on in the majority of COVID hospitalizations for kids in Canada was that they came in for something else. They had a broken arm, say, another issue, and they had to get tested for COVID upon admittance because that is the protocol in hospitals right now, healthcare facilities across Canada. And they found that a lot of these kids tested positive for COVID. They had very mild symptoms or asymptomatic COVID, and it was something that was not why they were there for hospital. But when the hospitalization statistics were reported, they were included in it. So the majority of kids hospitalized for COVID in Canada were not actually hospitalized for COVID. And that is from the Public Health Agency of Canada. Now, that, first of all, that's a very important thing to know. I've written about this before. I've discussed it before. A lot of people still don't know this. That news was not, I think, amplified to the degree it should have been. Now, when it comes to adults, that does not hold true. There are incidental findings of COVID for sure. An adult gets into hospital for whatever reason. They test positive for COVID and they are included in a COVID hospitalization tally. But the majority of adults are indeed in hospital for COVID. The ones who are, the statistics are more accurate for adults, is what I'm saying. However, a number of doctors who are in hospitals in Ontario and throughout Canada have told me that they believe that number will skew further into the fall. Basically, that there will be a greater proportion of people under Canada's COVID hospitalizations who are in fact incidental findings. People who, they're not actually suffering from COVID-19, they just happen to have tested positive. That number is going to go up in the fourth wave because of the number of vaccinated people and so forth. So I think that's just a really important thing that we need to discuss a bit more, because all of what I'm saying here, the basic idea of incidental findings of COVID-19 among hospitalizations, I think a lot of people, I'm sure the majority of Canadians aren't even aware that that's a thing. But as we see in the fall, if we see the reporting numbers show hospitalizations are rising, it's just important to get the nuance and the context. And you're going to want to ask how many of these are actual incidental findings of COVID-19, incidental hospitalizations. And I think another thing that should happen is that governments actually need to break that out in their public reporting. So in Ontario, for instance, they have to their credit acknowledged that case counts should not be the main thing people obsess over. So when Health Minister Christine Elliott posts numbers every morning, she actually focuses on the hospitalizations. So they've kind of evolved their reporting. She's not just saying, hey, look at these case numbers. She's saying, look at these hospitalization numbers. And then they also tell you the case numbers. That's a good step forward. But a further nuance that would be important is to break out the incidental hospital admissions for COVID-19. This is just one part of the conversation, one part of context, one part of nuance, but I think it's an important one, and I think it needs to be one that's considered by all.